Hi, this is Irene Owens, and this is the nursing process diagnosis. This PowerPoint correlates with Fundamentals of Nursing, Chapter 4 in Wilkinson. Nursing diagnosis is a second step of the nursing process. It is the phase in which you analyze your assessment data. You use your critical thinking skills to identify patterns in the data to draw conclusions about the client or the patient's health status. As in all phases of the nursing process, you should involve the patient and the family as much as possible in the diagnostic process. Most of the time, most nurses will usually begin their diagnostic reasoning during the assessment phase of the nursing process, and then you'll put it all together as you link your diagnosis to it. It includes the strengths, the problems, and the factors that contribute to the patient problems. Diagnosis is critical because it links the assessment step, which precedes it, to all the other steps that follow it. Accuracy is essential because the nursing diagnosis is the basis for planning client-centered goals and your interventions that you're going to be doing as you take care of your patients. The evolution of nursing diagnosis really started back in the 1950s and the 1960s. The term nursing diagnosis itself was first used in 1953 to differentiate nursing from medicine. And I thought it was interesting that it was stated that the client's needs for nursing rather than for medical care, and that's kind of how they distinguished that nursing diagnosis. So as we look at the 1980s from the American Nurses Association, they stated that the diagnosis and treatment of human responses to actual or potential health problems is one of the definitions that has been available since 1980. And in 1980 also, most of your state nurse practice acts began to designate nursing diagnosis as an exclusive responsibility of registered professional nurses. So that's one thing that does differentiate us from our other peers. So as we differentiate our diagnosis, as we did with our assessment, we look at the medical diagnosis, which describes a disease, an illness, or an injury. Its purpose basically is to identify a pathology so that appropriate treatment can be given. Medical diagnosis is a whole lot more focused than a nursing diagnosis, such as you can have a client with the same medical diagnosis but may have a different nursing diagnosis based on the response to illness, and that's important to always remember. Nursing diagnosis is a statement of the client health status that nurses can identify, prevent, or we can treat independently of our physicians. A health problem is any condition that requires intervention in order to promote wellness or to prevent or resolve resolve disease or illness. And we always decide how to treat that, whether we can do it independently or we need to collaborate with our physicians. Nursing diagnosis provides the basis for selection of nursing interventions to achieve outcomes for which the nurse is accountable. So when we make our decisions, we gather our data and we make our assessment, we're accountable for that assessment and making a nursing diagnosis based on it so we can provide good outcomes for our patients. Collaborative problems. Your book goes over different types of problems that you can you can help your patient with. And when they talk about collaborative problems, these are certain physiological complications of disease, such as medical treatment or diagnostic studies. All patients or clients who have a certain disease or treatment are at risk for developing the same type of complication. So this is always a potential problem. It gives an example in your book about Todd because he has type 2 diabetes. He has a collaborative problem of potential complication of type 2 diabetes, which would be hyperglycemia or hypoglycemia. And all other patients have that same type of problem. So that's always a potential problem when you look at collaborative problems. This slide goes over the different types of nursing diagnoses that you can come up with to determine the status of each diagnosis. That's an actual, a risk, a potential, a possible problem, a wellness diagnosis, or a syndrome diagnosis. An actual nursing diagnosis is a problem response that exists at the time of the actual assessment, and you can usually identify that by the signs and symptoms that your patient has, or those cues that you have gathered. A risk nursing diagnosis describes a problem response that is likely to develop in a vulnerable patient if the nurse and the patient do not intervene to prevent it. Possible nursing diagnosis exists when your intuition and experience direct you to suspect that a diagnosis is present, but you do not have enough data to support the diagnosis itself. And basically this is to alert other nurses to continue to collect data to confirm or rule out any kind of problems. A syndrome diagnosis represents a collection of nursing diagnoses that usually occur together. For example, your book gives NANDA, the label risk for disuse syndrome, is used to represent all the complications that can occur as a result of immobility, such as a pressure ulcer, constipation, body image disturbance. Then your wellness diagnosis is basically when an individual, when your patient or client is in transition from one level of wellness to a higher level of wellness. Your book gives a great schematic of this algorithm. It's figure 4-3 on page 60. So if you can't read the slide, you can go to page 60 in Wilkinson, and that may help you. Here's our little clicker check again to see how we're doing. And the question reads, the client's activity level has decreased post-op hip replacement surgery. She has been receiving opioid analgesia and has decreased fluid intake. The nurse chooses, is it A, risk nursing diagnosis, B, a syndrome nursing diagnosis, C, an actual nursing diagnosis, or D, a possible nursing diagnosis? And the answer is A. The data, the cues, those defining characteristics, which are all signs and symptoms, suggest that the client is at risk for constipation. So hopefully everybody got that right. So why are we even thinking about diagnostic reasoning, and what is diagnostic reasoning? It's a comprehensive patient assessment, provides a great deal of data for you. So you have to take that data, and you have to have a thinking process that enables you to make sense of it. So that's your diagnostic reasoning. You use it to critically think, to analyze and interpret data, draw conclusions about your patient's health status, verify the problems with the client, prioritize the problem, and then record the diagnostic statement. So when we analyze our data, you want to narrow the field of that data. You identify the significant ones. You cluster the the signs and symptoms and what goes together, identify the data gaps and the inconsistency so you can validate, draw conclusions about that data and for your patient's health status. You do make inferences. You know, I said before you don't make inferences. Well, now I'm saying you do make inferences because inferences are based on your data that you collected. So you have to make some inferences as we analyze our data because that's part of problem solving and is part of critical thinking. So we also want to identify problem etiologies as we go through and analyze our data, and we want to verify our problems with the patient and the family. When we prioritize our problems, we basically put our problems, place our problems in order of importance. It doesn't mean that you have to resolve one problem before attending to another one, but we really look at our theoretical framework as we look at prioritizing. And you're going to be having a lot of priority type questions on boards. You'll have a lot of what should the nurse do first? Based on patient scenario. You'll have a lot when you're taking care of patients. How am I going to prioritize these 5 patients that I'm taking care of? So basically when we prioritize, we use Maslow's hierarchy of human needs. And if you turn to page 65, it goes over, it gives you a schematic, figure 4-6, about Maslow. So you need to really review Maslow's hierarchy. You look at the physiological need of patients, and that's food, air, water, temperature, regulation, elimination, rest, sex, and physical activity. And when you look at prioritizing problems, you're going to look and make sure that the physiological need of your patient has been met before you can go on to a higher need, which may be knowledge and understanding and exploration of maybe the surgery that's upcoming for them. You can also use what they call problem urgency as ranking your criteria. You can look at the high priority to problems that are life-threatening, such as ineffective airway clearance. Medium priority, it's not a direct threat, but may cause destructive physical or emotional changes. And our low priority, no problems or requires minimal support, supportive type nursing interventions. So on our ClickerCheck, it says identify the priority nursing diagnoses. A is impaired verbal communication related to altered central nervous system. B, fluid volume excess related to compromised regulatory mechanism. C, impaired physical mobility related to discomfort. Or D, activity intolerance related to generalized weakness. And the answer is B, Maslow's hierarchy of human needs. And you can go back to page 65 and look. It places needs as a priority. Fluid volume excess can lead to pulmonary edema, impaired gas exchange, and respiratory failure. So fluid volume excess is therefore life-threatening, be a high priority when ranking problems according to the problem urgency. So you have 2 things that you can go by when you're trying to prioritize on questions, on testing, and in clinical situations. Okay, this slide goes over our self-knowledge. I think you have to realize that your beliefs, values, and experiences affect your thinking. and it can sometimes be very misleading. So you have to kind of ask yourself these questions on a personal note, and know what some of your biases are, and what may influence those biases or stereotypes. Okay, so now we're going to talk about the NANDA, nursing diagnosis, and the components of a nursing diagnosis. So how are diagnostic statements written? We'll talk about how it's written, what kind of resources, because you cannot do a nursing diagnosis without resources. You have your Fundamentals of Nursing, Wilkinson, your Volume 2. It goes it's on page 32 and 33. There's some standardized language there that we use. This is the NANDA format. And NANDA is the national, I always have to look it up, the National Association Okay, the NANDA stands for the North American Nursing Diagnosis Association, and then they have created what they call a taxonomy, or it's a taxonomy of nursing diagnosis labels and the description for those labels to help us as we diagnose our patients in the nursing process. So it's a diagnostic label, and if you look on page 32 in Volume 2, it goes over the standardized language that they use. It talks about the domains, and it talks about the different classes. It talks about the definition of each one, especially if you go and you look in your back of your Tabers. I think that's one of the most excellent resources that you have. It tells you the definition of the nursing diagnosis, the defining characteristics, which are the signs and symptoms, the related factors, and the risk factors that are involved. So the client has reddened skin and an open abrasion on his elbow from prolonged bed rest. In examining the components of the nursing diagnosis, which is impaired skin integrity, the reddened skin and open abrasion would be the related factors, the risk factors, the defining characteristics, or the diagnostic label. And the answer is C. These are the defining characteristics. Those are the signs and symptoms that allow the nurse to identify a client problem. So we look at this next slide, and it says how to choose a NANDA label. When you have collected your data, you first identify the broad topic or the domain that seems to fit the cluster, or the signs and symptoms, or the defining characteristics. Those are all synonymous type terms. So if you look at page 32 in Volume 2, it will say domain. So the domain is health promotion. Domain 1. Domain 2 is nutrition. Domain 3 is elimination and exchange. Domain 4 is activity, and so on. Okay, so then we need to narrow our search to the class or the most likely labels that would fit with the data that you collected. And the class, let's say under let's go under Domain 3, Elimination and Exchange. We go under Class 2, which is GI function. It gives a definition of it, which is the process of absorption and excretion of the end products of digestion. And then we look down and we say, what are some approved diagnoses that may work for my patient? Narrow your search to the class. So the class would be GI function, especially if your patient maybe has constipation. So that would be the class. You always have to use a nursing diagnosis handbook, some kind of resource to compare definitions, define the characteristics of the diagnostic labels with all your signs and symptoms. So how does nursing diagnosis relate to outcomes and interventions? Basically, the problem will suggest what the goal would be, and the etiology suggests what kind of interventions will be done when we take care of the patient. In this slide, it's basically asking us to write quality statements when we look at our nursing process diagnosis. So there are some formats for diagnostic statement, and the diagnostic statement consists of that problem and an etiology that's linked by a connecting phrase. And this will all make a little bit more sense after you read pages 72 and towards the end of this chapter. But you choose a NANDA label and you include both the problem and the etiology. Be sure that the etiology does not merely restate the problem, and you avoid using any kind of medical diagnosis and treatment as etiological factors. It gives you an example of this on page 72. Let's see, anxiety. There's one with anxiety on page 72. And one of the patients, his name is John, and he has anxiety related to lack of knowledge of the treatment procedure. And Janet has the same nursing diagnosis, which is anxiety, but the related to the etiology is prior negative experiences and lack of trust in health professionals. So they're two different etiologies, but it's based on the same nursing diagnosis. So you have to know exactly what's going on with your patient in order to make the nursing diagnosis and the related to make sense. It can't just be an overall blanket statement when it comes to the etiology or the cause of that problem. This next slide gives us some more hints on how to write the quality statements. We need to write it very clearly, write the statement concisely, be descriptive and specific, state the problem as a patient response, such as, remember John and Janet, they both had anxiety. That's a patient response to a stressor. Use non-judgmental language and avoid any legally questionable language. That's very important as well. And so if you use this critical thinking slide, it states that for each of the following Q clusters, which are your signs and symptoms, decide whether the signs and symptoms represent a pattern, that is, are all the Qs or the signs and symptoms related in some way? If so, explain how are they related. If not, state which Q does not fit. And if you do not have enough theoretical knowledge to know for sure, draw on your past experience and discuss this, with other students in your classroom if how these all go together. Towards the end of your book, on page 74, it goes over a three-part statement with your problem, your etiology, and your symptoms, and that's basically what you're going to be using as you define and you diagnose your patients based on your assessment. So if you look at, there's the problem, so it could be anxiety related to, let's look at Janet back here. She has related to prior negative experiences, and it's evidenced by, what is it evidenced by? Patient not talking, patient stating, I'm so anxious, I've been here before and I don't want to be here now. So whatever your signs and symptoms are. And we're going to practice these, so these nursing diagnoses as we go along, and we'll put them in different concept maps, linear maps, so that when you do go into the hospital and you identify problems, we have some way of scientifically stating the nursing diagnosis so that we can improve our outcomes as we go through our nursing care with our clients. Okay, that ends part 3, and the first week is over. Congratulations.